It's good to have you once again, Dr. Lydia. Karibu sana. So today I want us to talk about feminine health and vaginal health. And I know it's a topic that we hardly ever talk about. Just ladies understanding their, feminine organs and being aware.
So I think it starts all the way from growth and development in terms of as the young girls get into puberty. Now there's a lot of awareness about what changes they should expect, even all the way to menstruation. And now as they get to the various phases of life, vaginal discharges are normal in that they're just various phases of like the menstrual cycle. The cycle means a time from when menses begin to when they'll begin again. That in between, which for some people it's 28 days, that has a different kind of characteristics of the discharge that could be seen. So we usually look at, you should be worried if the discharge is high in amount, to the extent that you have to put on a pad, or you feel like there is a bad smell, or it is different color. So that should worry you, or the other symptoms of pain or itchiness or an ulcer, or having a wound in the vaginal area. So any of those should worry you. And so some could be a sign of an STI, a sexually transmitted infection, but then there's also just the normal discharge that gets a little thinner as you go towards mid-cycle, in between your menses. It could be thinner and a little more. And those who use contraceptions like coil or the IUDs in intrauterine devices, they could likely have a little bit more discharge. So in all that spectra, be worried in case the amount is a lot. There's increased pain and itchiness, or it has a smell and odor. A yeast infection is most of the time dramatic because there's an increased whitish discharge. It can combine yeast plus others, so that there's also itchiness associated with it. Then you know that there could be yeast together with trichomoniasis, which is common. So yeast infections are common, and they could really recur. And so just having, first of all, good hygiene, airing the inner pants well, that you're putting on dry ones and having enough of them. Then just also the hormones. There are times that towards the menstrual period or immediately after, there's a higher chance of having the itchiness, if it was maybe not fully treated. But they are very easy to treat. And when there is an episode, during the treatment time, we recommend they could even sleep without innerwear, so that there's just time for healing to take place. A classic yeast infection, like curdled milk, it is white. It will even be on the panty. So it is thick. The normal discharge is usually thin, and it gets much thinner towards mid-cycle. That is between your days of the menses. Typically, vaginal itching is not normal. It's the discharge that has variants that are within normal. Unless it is too much, bad odor, and a different color, then you know there's an issue. I know for pads to be passed, they have to be approved. So essentially, they should not cost that. So that means that there was something wrong, because all products, because they come in touch with your skin and they get wet because of maybe the menses or a discharge. That could be normal. So if they had anything that could trigger itchiness, then those are not acceptable. Just normal hygiene. And hygiene means you don't need, the vagina doesn't need to be cleaned with a douche or with chemical. Just cleans itself. But unless advised specifically, it is not a routine habit that we ask to happen. In fact, for some cases, it can increase the risk of infection.
Okay.
Yeah, by just that abrasion of trying to do it. So yeast infection is very common among the pregnant women because their level of immunity is a little different than the non-pregnant one. So it is common, and usually we treat it. And it can be very disturbing.
Yeah.
So it is good for the pregnant women to raise up any form of abnormal discharge that they may be having. Then they can be put on treatment. Yeah, actually many people just go over the counter and they pick some drugs, but it's possible you may be treating yourself for what you don't understand.
Sure.
Then also there are other causes, like after strong antibiotic, you may have a yeast infection because you've killed the other bacteria, normal flora, on the vaginal area, and so you can just get a yeast infection. So it's good to know what caused it so that you're advised. I think you just shower.
Yes.
And put on clean clothes. In a few cases, we find that, there's a cause of worry need to be treated, but there are some whereby it's become a routine and it's in their head. So that one needs a different kind of help.
Yes.
Yeah, but I think just normal hygiene that you can do to your to the young girls, the same one even women of reproductive age should, and during menstrual period, just to now be cleaner.
All right. Well, thank you so
Yeah.
much, Dr. Lida. I appreciate you just getting to inform us a little bit more about just how we can take care of our vaginal health and just feminine health. We appreciate you. Thank you so much.
Thank you too. It's my pleasure. If it could be of help to the public
Yes.
and the younger girls, because they have a lot of questions, the better.